They are the front line and the backbone of the healthcare system. Today we're going to meet the registered nurse. Lindsay and Brian.
Hi, Brian. Nice to meet you.
Nice to meet you.
So you're going to come see what we do?
I'd like to.
All right, come on. I'll show you around.
Thanks.
My name's Lindsay Bateman, and I'm a registered nurse. I've been a nurse for 15 years. I'm currently the patient care coordinator at EKRH. I have a specialty in critical care and emergency, as well as pediatrics. A registered nurse directs patient care. So she or he is the primary nurse responsible for the care of the patient. So you're doing a lot of coordinating care with various disciplines, whether it's social work, physicians, diagnostic imaging staff, doing a lot of communication. A good part of your day is spent giving medications and doing treatments for patients and just spending time with them as well as their families. But it's also very technical, which is where it gets really cool for nurses who like machines and technology. So you kind of get a good range of everything all put into one career. Once you get to work, you're pretty much running all day. There's not a lot of downtime. We spend the first part of our shift getting reports, so that's talking to the nurses who are on shift previous to you. A little bit of communication back and forth about what's happening that day. At the end of the day, you're exhausted, but you've had a great day. You learn something new. Every single day you learn something new.
So Lindsay, tell me, is it a long process getting into nursing?
Actually, you know what, if your marks are good enough in high school, you can apply to pretty much any nursing school right away. The RN program is usually 3 to 4 years. Generally, to get into a nursing program, you have to have some basic level college experience, so sort of university transfer courses, courses in chemistry, basic math and English are generally prerequisites to get into a nursing program. At the end of your nursing school, typically what you do is they put you in something called a practicum. So you can actually be placed in a hospital ward pretty similar to this, anywhere you want to go, emergency, ICU, anywhere. So coming out of nursing school, you have a body of knowledge, and every single day that you work as a registered nurse, you're building on that. There isn't a day that you come to work that you didn't learn something you didn't know about the day before. So you're constantly having to be educating yourself and reading, as well as learning from your coworkers. So much of your job as a registered nurse is interacting with people, whether it's your coworkers, other staff members, and most importantly, your patients and their families. You have to be able to connect with them. Hi, Jim. How are you doing?
Doing fine.
How are you feeling?
Much better today, thank you.
How's that IV we put in?
Good.
Still looking good, hey?
Yeah,
How's your breathing today?
much better.
It's feeling better? Is you ready if I check your blood pressure here? It's absolutely critical to be able to do the complex tasks that we need to do. Anything from inserting IVs to, I mean, any sort of task that you do in nursing, you have to, there's a precision about it.
How important are the nurses here, Jim?
How important? How could we live without them?
But a huge part of nursing, and I don't know if you'd call it a skill, is having compassion for other people, and coming at your job in a non-judgmental way is a big part of nursing. The opportunities for nursing are endless today. You can do anything from educating, you can be a nurse practitioner, you can actually work on a flight crew if you wanted to. Opportunities within the hospital and the community, you could basically do anything in nursing. I think like the variety of types of nursing, there's also varieties of shift work. There are some nurses that love doing night shifts and that's all they want to do. There's some nurses that do days, nights, 12-hour shifts, 8-hour shifts. There's basically any variety that you want, you can seek out in nursing and find. There are nursing jobs that are Monday to Friday, 7 till 2:42.
So Lindsay, this has got to be a really fast-paced environment.
You know, most hospitals are really fast-paced, and some days it's hard to even sit down, but that's part of why we love it. It's constantly exciting, you're constantly doing something new. Nursing is one of those jobs that lets you touch people's lives like nobody else can. I mean, I've held people's babies in my hands, helped people through the worst day of their life, and I've been there for the best day of their life. I've done the most amazing things as a nurse, so what other job do you know where you can do that?
Well, Lindsay, thank you very much for showing me around today. I really appreciate it.
Thanks for coming.
Take care. Once again, I'm Brian for Career Check, reminding you that this career could be yours. See you next time.